why do we still need drugs? And why do we, with all these new drugs, which usually are not enzyme inducers, we're still talking about enzyme inducers? The problem is that in epilepsy, we have a law of decreasing returns. So the more drugs we use, the outcomes or the response is not as great as we would like to. You could argue with depending on how to count, we have nowadays over 25 drugs in the armamentarium for epilepsy. And we still have about 20 to 30% of people that have not really do not derive benefit from the drugs. So yes, we need new drugs, but also new drugs often come with a cost. So, this you can see that there is still a place for cheap drugs in the mind of some people. Of course, you could also argue that some of the enzyme-inducing drugs we have, they are very effective. And people sometimes, knowing that they are effective, they may prefer to use this drug because they know it's an effective drug. So this is the issue. I don't think that at the current level we will need a number of new drugs, but more importantly would be for us to understand what is behind epileptogenesis, and then we're finding disease-modifying drugs that will deal with the epileptic process rather than developing more drugs that will just stop the symptom, which in this case is the epileptic seizures.